HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. Join Dr. Ardolic as he meets with leaders of our comprehensive weight loss center team, Dr. Chiara Ortiz-Pujols and Dr. Christopher Esposito. Hear them discuss how Northwell Staten Island University Hospital is taking an individualized approach to help them achieve their weight loss goals. Give it a listen.
Hey Staten Island, welcome to HealthWish. Got two amazing people that have changed how we take care of people with obesity on Staten Island. Got Dr. Chiara Ortiz-Pujols, who is our Director of Obesity Medicine. Welcome.
Thank you for having me.
And Dr. Chris Esposito, who is our clerkship director for our surgical clerkship, as well as one of our bariatric minimally invasive surgeons and general surgeon. Welcome.
Thank you very much.
And we are in this amazing place. This is Retire Fit on Staten Island, and it's a place that's really been developed to take care of people so that they actually are more functional as they grow older, something that people should be thinking about a lot younger than they actually do. So Dr. Ortiz-Pujols, I think a great place to start would be, what does it look like for somebody to come into an obesity medicine practice and start to go through the process?
Right before coming here, I have a perfect example of a 22-year-old young woman who has been struggling with obesity her entire life because she has been through so many different experiences, both within her own family unit, her societal, the way she's treated at school. One of the things that we try very hard is to make it a safe place, a no judgment place, and to put them at ease. We can help them be successful. When it comes to weight, it's rarely something that is a one cause thing. You have to look at the entire picture. We have to understand everything in order for us to be able to start to craft a plan that will make sense. So how can we take that into consideration when we're developing a plan that touches on lifestyle, medication, surgical, nutrition, sleep, and mental health? So all of those things we try to get an understanding in that first meeting.
What does the spectrum of medical versus surgical look like, and kind of how does that actually fit, and how do you present people in a way that you can let them make really good choices about their own health?
One of the things that I like to focus on, especially if someone comes in and they're not sure if they want medicine or surgery, is what are your goals? Where are you trying to get to? Some people come in and they want to lose 25, 30 pounds. Medications absolutely will get you there. Some people want to lose 250 pounds. When we're in that spectrum, we're not talking maybe even just about surgery or just about medications. We might be talking about a combination of both. And a lot of people don't realize that they're not mutually exclusive. You can do both. But I always like to have the goal conversation first, because if they're saying, I want to get to 250 pounds from 450 pounds, then it's not probably going to be feasible. So it's always a good idea to have the relative expectations for what you can achieve and what you can't achieve with certain goals. Now, can some people be the outliers and lose a lot more? Sure. But medicine works on data, and data is pretty consistent on where you can fall in. Now, some people tolerate the medication really well, some people don't. Some people lose a lot of weight with the surgery, and some people don't. So we like to make sure we have a very individualized approach about how we're getting people to where their goals need to be.
Regardless of where you are in that spectrum of getting better and getting healthier, we're in this with you, right? You're going to see the same cadre of doctors, you're going to see the same medical doctors, the same surgeons, and be able to do this in a place that you're going to be ultimately comfortable.
Oh, absolutely. And the dietitians, let's not.
Absolutely.
The dietitians are key, and they're kind of the glue because they work with all of us. They understand all of the challenges, and they're fantastic when it comes to continuity of care.
I have one patient who has been making slow changes in their family's diet without telling people the changes are happening, where she's like, I stopped using salt and I stopped using butter. No one notices. They think their taste buds are changing. And I'm like, I don't support the deception, but I appreciate it and I respect it, because a lot of people don't really want to make that change. And if you don't, as a family, make that change, it can be really challenging for one member of that family to really make a concerted effort.
Yeah, listen, I'm Albanian. It's a big joke in the Albanian culture that if you don't eat a pound of bread with every meal, then you're not really Albanian. My dad will sit down and have a plate of potatoes and then actually go get some bread to eat with his potatoes, because it's just part and parcel of who we are. Changing some of those things around is really hard to do, and yet those things are the things that actually keep you healthy.
I mean, I'm Puerto Rican, and so a lot of our food is fried, and of course, rice and beans, right? But people say, well, I can't eat this because I eat rice with every meal. But you can. You can. It's about how do you adjust the portions. Some of the wonderful fried foods can be made in an air fryer. So starting to have conversations like that you can still have your cultural needs met, still have the big family dinners that are so important for so many of us. But slight modifications will allow you to kind of inch forward in your goal.
I have found in my own life, as well as many patients, that people that decide they're going to go from being completely sedentary to working out 3 times a day, or people that decide they're going to go from a 4,000 calorie completely poor diet to a 1,500 calorie completely plant-based diet, they struggle. Tell me what you think about the concept of incremental change as opposed to my whole life changes on January 1st for my New Year's resolutions.
For anything weight loss, consistency is king. And if you decide I'm gonna do this crash diet, you're gonna crash back to earth, essentially. And that's been pretty consistently shown throughout the literature and through personal experience. There is no real diet that's successful. It's lifestyle changes. That's what we kind of change the culture of how we approach weight loss. Is it's changing your lifestyle. And you can't just go from a carb-heavy diet to somebody who's just, completely keto and not eating any carbohydrates. So we try and make those little tiny moves slowly at a time and see what things you can be consistent with. I've had patients who say, I can't really get good hydration. I don't like the taste of water. We tried Crystal Light. Have you tried this? Have you tried that? It's about finding that thing that you can do consistently. If you find that thing that you can do consistently, you will do it consistently. And that's how you get the best weight loss.
For a lot of people, they're in so much pain, the thought of exercising for 30 minutes or 150 or even using the word exercise is daunting. So if you say movement, start small, 10 minutes, 15 minutes, and add 5 minutes at a time, that becomes much more doable. And that really ties into that incremental change that will hopefully you can build on.
Mental health. I cannot tell you how many articles and how many videos I've watched that talk about reducing stigma with mental health and how everyone knows that this is not something that is any different than a medical problem with people that struggle with obesity. It is amazing how this perception of this is a weak person or this is just a person who can't control themselves, as opposed to what we know about mental illness, which is depression is a terrible thing, anxiety is a terrible thing, and contributes to all sorts of diseases, not just obesity. How do we continue to get this message out, and what do we say differently, not just to our patients, but also to their family members and their support systems, to get them to understand that it's really no different than diabetes or anything else?
That's also a huge part of the multidisciplinary approach that we have. For any patient that's considering surgical weight loss, we do have them have a psych evaluation. That's part of the process. That's actually part of the majority of insurance providers in order for them to actually pay for the surgery, because it is such a critical part of the process. When you're in the weight loss program and when you're losing weight or when you're struggling to lose weight. And you see it a lot in the family structure. And a lot of times when we do have consultations for patients who are considering weight loss, and particularly if there's a family that maybe doesn't support the weight loss, we always encourage them to have their support system come for an appointment. The reason being is if you are planning on losing weight and the people around you are not planning on supporting you with that weight loss, which is a more common story than you think it would be, where someone's coming here and their family doesn't even know they're here and they want to learn about weight loss because they see the lines kind of drawn on the map. My father, had heart disease when he was young. My mother died at a young age. They all had obesity. I have obesity. I can see where this is going. I need to change things. But maybe their sisters or their brothers really don't think that that's something that's a reasonable thing for somebody to do, and they feel like they are trying to go through this in secret. And we really want to encourage information and to try and pass on what we know is an effective strategy for them to prolong their life, decrease their risk of cancer. A recent study came out that it's a 30% risk reduction for breast cancer weight loss surgery. So these are things that you can really make really big strides in decreasing your overall morbidity and increasing your longevity.
HealthWish wishes to thank our special guests, Dr. Brahim Ardolic, Dr. Chiara Ortiz-Pujols, and Dr. Christopher Esposito. Recorded at Retire Fit. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.